Welcome, Stephen Lewis. When Canadians think of quality in healthcare, they tend to focus on waiting times and treatment shortages and not enough staff. But you think there's a broader issue in our health system. What is that?
I think we've paid much more attention to how much service people are getting than whether it's properly organized to deliver them high quality care. So for example, if all you have is a very minor problem and you only have an episodic system where you go to the doctor, it's a 2-minute conversation, you leave with a prescription, probably works for you. But if you're one of those millions of Canadians who have a number of disorders, if you're 82 years old and frail, for example, you probably need a team. You need a doctor, you probably need a nurse educator, you may need a nutritionist, you may need fairly complicated care, even in the community. You might need, yes, medications, but you may also need some therapy. You may have some cognitive problems that you need help with. You may need some home care. And that's where the system tends to get a little shaky.
Why is the public accepting this situation? Why? They're conscious enough of some problems in healthcare, but they don't seem to be worrying about this lack of quality in the community care, in their everyday care. Why is that?
Again, I think the public has been mainly focused on access. Are there enough doctors? Are there enough nurses? How long am I going to have to wait? And we haven't actually produced a lot of information in this country about the quality. We're just getting into the information revolution, starting to measure, starting to report about quality issues, both good and bad. So it's not been part of the public conversation. The media tends to focus much more on access and shortages or perceived shortages than about quality. And frankly, Canada's a little bit behind other countries of focusing on quality.
What will it take to get more recognition of the quality problem? Are Canadians afraid of being disloyal to their doctors and they won't complain? Or does anybody really know what quality is and how to define it?
Well, I think we know a few things about what quality is. If you have a certain problem and there are clinical guidelines and good research that shows this is what you ought to do, then yes, we could improve that. But again, we haven't monitored and followed up particularly well, so we haven't always known. How do you get people interested in this? I think providers have to participate in it. I mean, I think they have to take a look at what they're doing and recognize that, yes, we can work longer, we can work harder, but if we're not working smarter and if we're not working together and we don't use good information technology to help us in our decision making and care, then we may be doing all of this in huge volumes and working like crazy, but it may not be actually improving the quality of care that we deliver.
Are there models here or around the world that for good quality care that we could adapt and use in Canada?
There are some tremendous examples, and while we often compare ourselves favorably to the American health system, and overall I think we win hands down, there are parts of it that are fabulous. The Veterans Affairs system in the United States in the mid-90s was frankly a basket case. It was a terrible system. Within 3 or 4 years, with great leadership and attention to information technology, working in teams, setting expectations, setting goals and measuring them, it almost went from worst to first in about 2 years. And it remains consistently at the top when you measure it on major quality indicators. The Group Health Cooperative in Seattle is a model health organization that serves several 100,000 people. Just as an example, they are very rigorous about assessing drugs and whether they're going to be useful. So there are beacons around the world, actually, of examples where, yes, quality has improved greatly. Has any one nation across the board achieved fabulous quality? I don't think so.
Often when people talk about improving quality of care, we say we need more accountability and more transparency. What do those terms mean in this context? I mean, how would more accountability work to improve quality? How would transparency improve quality?
Well, accountability simply means this is what we expect you to do. We're going to measure it, we're going to give you tools to help improve, but ultimately the system is accountable for achieving those goals. And if they don't, the response isn't to beat them up and take away their money. It's to say, what can we do to improve this? And we'll compare you against your peers, we'll help everybody to get better, and we'll work cooperatively to make sure that we're doing things the right way. Transparency simply means people can see how good the quality is. So for instance, and we're starting to do this, what's the heart failure rate or what's the heart attack rate in my community compared to yours? When we go into the hospital to have our bypass operations, what's the 30-day mortality rate in Saskatoon compared to Regina? If it's higher in one community than the other, what can we do to help the other community get better? And we just need to see it both as the governments and the people who fund the system on behalf of the people, And in some cases, I think it does help patients make a choice.
Where would you start? What would you start with to start improving quality?
I would do two things. First of all, and this doesn't sound terribly dramatic and useful in a way, but we really do have to measure better, and we have to report, and we have to feed back information to people who work in the system that is useful to help them improve. And that has to be done with current, up-to-date information, not two-year-old information, which has been the Canadian norm, because we haven't done things in what's called real time. And then the next thing I would do is to really help people to improve by giving them the tools. They do need information and information technology. They do need practice guidelines. They do need opportunities to learn and practice together. So physicians, for example, don't have to remember everything themselves. If the therapist knows more about therapy, hand it off to the therapist. It would be a good thing if more physicians consulted with pharmacists about the drug interventions, because pharmacists may know more in some circumstances.
So it's a question of building that team you were talking about.
Build the team and make sure everybody's working to their maximum capacity. We have a tremendous amount of unused intelligence and knowledge in the system because, frankly, there is some turf protection among professions. Not everyone is allowed to do the things they know how to do. They don't work together enough. The communication is just beginning, and we haven't organized ourselves so that these people can work together for the betterment of their patients without running into some disincentives like who gets paid for it, where's the money going to go. But all of these things have to be addressed.
Stephen Lewis, thanks very much.
You're welcome.